So before I jump into the resources and the questions, I want to briefly just clarify the difference between delegator and delegatee. Delegator is just the nurse that is asking somebody to perform a task. So that's the delegator, it's the nurse. And then the delegatee is the individual that is responsible for completing that task. 2 helpful tips I want to go ahead and just stress right now that we can use as we navigate these practice questions on the next couple of slides. The first one is we don't delegate tape tasks. So tape tasks, it's just a good memory tool, but it's basically saying we're not going to delegate steps of the nursing process that require clinical judgment. So these include teaching, assessment, planning, and evaluation. That is the registered nurse's job. And then lastly, this is a very, very important tip. We only ever delegate routine tasks for stable clients. So if it's not a routine task or it's an unstable client, automatically we should be able to rule that option out, and we know it would not be appropriate to delegate. So I know that many nursing students and new graduate nurses really struggle with some of these management of care topics, such as delegation and priority setting, and that is because you just don't get as much practice doing these skills before you get out into the real world and you're in practice. So one of the best tips is to use our resources. So when we're talking about delegation, there are 2 resources we should always take into consideration that are going to help us make sure that we are delegating appropriately. The first one is the care provider scopes of practice. To put it simple, that's just what can everybody else on the nursing unit do? So everybody's scope of practice. What are they allowed to do legally? And then the 5 rights of delegation. So both of these resources are really going to help us as we navigate delegation items. And of course, once again, help us navigate delegation when we're in the clinical setting. So let's briefly talk about these 2 resources. The first one, the provider scopes of practice. So let's talk about each person's scope very briefly. The first person is the RN. So the RN is going to have the largest scope of practice out of anybody else on that nursing unit. We are taking care of all clients, whether they are stable or unstable. We have a big responsibility, and we are able to perform all steps of the nursing process. And we should be the only one as an RN that ever performs the initial steps of the nursing process. The teaching, the assessment, the planning, the evaluation. All of these things require clinical judgment. And we have spent many years in nursing school gaining a lot of knowledge in clinical judgment. And these things really come into play when we are performing the nursing process. So we need to use all that knowledge, and we are responsible for, once again, all steps of the nursing process. And we are also responsible for all tasks, routine, non-routine. So then let's move on to LPN or LVN. Now that is the same role. They are just called different things depending on where you live. So the LVN is also a nurse, but they can only care for stable clients. And this is where I'm going to go ahead and I'm going to just warn you guys to be very careful whenever you are doing any questions to not try to think about, wait, I saw this thing in clinical. Or one time whenever I was caring for a patient at the hospital, an LVN did this. That can get you in a lot of trouble, because me personally, before I was a registered nurse, I was an LVN. And I oftentimes got asked to do stuff outside of my scope of practice, such as being asked to care for unstable clients and all kinds of other things. So please pay attention to the scope of practice and not necessarily what you're seeing in practice, because unfortunately, it's not always correct what we're seeing out there. LPNs can only care for stable clients, and they can perform some portions of the nursing process, but that's only if the registered nurse has already initially performed them, okay? So I know that's one little gray area that can kind of be confusing to students. So just to further clarify, LPNs can repeat certain tasks if the RN performed them first. So an example, they can reinforce teaching that the RN already provided. They can monitor assessment findings that the RN has after the RN has performed the assessment, and they can assist the RN with care planning once that registered nurse has developed that care plan. They are only able to do routine tasks, so tasks that don't pose a lot of risk. Some examples are wound care for a basic wound, collecting specimens for a lab sample, those types of things. And then lastly, the UAP. And I will tell you, most delegation items involve delegating to the UAP. So it's very important to know this UAP scope of practice. They can only ever care for stable clients. They can never perform any tape tasks or any portion of the nursing process. They can only do routine and non-invasive tasks. Some common examples are vital signs, helping ambulate a client, and they can never administer any type of medication. So that gives you a basic overview of each person's scope, so that will certainly help us here in a second when we're navigating these questions. Another great resource that we should always take into consideration are the 5 rights of delegation. All this resource is a series of questions we should be asking ourselves when we're trying to determine, is this task appropriate to be delegated? So that first right is person. And that's just asking, is this delegatee, this individual, competent to perform the task? Do we think that the person has the appropriate education and knowledge to be able to perform this? The second right is task. Is that task routine, or is it something that's going to pose a lot of risk to the client, such as an experimental treatment or something that we don't think that the client will necessarily tolerate well? And I'll give you some examples in the questions. And then we, of course, have to refer back to that scope of practice. Is this task within that delegatee's scope of practice? And then the third right is circumstance. Is that client stable? And can the RN supervise? So we all know that delegation is very commonly used, but it's really commonly used whenever we're busy. So here's kind of a little tricky thing is, a lot of times whenever we're busy, we want to delegate, but the RN must always be readily available when they've delegated a task to be able to assist, answer any questions, and help. And then one more really important tip for NCLEX I want to make sure you understand that kind of makes delegation scary is that we are always responsible for the outcome of the task as the registered nurse. So if you delegate a task and someone performs it and something goes wrong, you as the registered nurse are still responsible and accountable for the outcome. Always want to make sure we're delegating appropriately. The fourth right is making sure that we give clear instructions on the expectations. I can give you a perfect example. We wouldn't want to ask a delegatee, can you please go get vital signs and tell me if the blood pressure is abnormal? We want to be very clear and specific. We can say, will you please go get vital signs on this patient? Please tell me if their systolic blood pressure is greater than 120. And it's always important too to have a timeline so we can ensure that that client gets the care they need in a timely manner. So telling them, can you please make sure we do this in the next 30 minutes or the next hour? And then the fifth right is supervision. And we always, as the registered nurse, have a responsibility after we delegate to go back and make sure the task was performed correctly and that we evaluate the situation to make sure everything is good with that client.